Hello and welcome back. My name is Nate Marble. I'm your host for our podcast today, and I'm sitting here with interviewing Jen Hedrick, who is our clinical director as well as associate executive director here at Discovery Ranch South. In this podcast, we're going to be exploring different therapeutic options for teenage girls with ASD and ND, and provide guidance on when residential treatment might be a good fit. And as always, I want you to remind you that this podcast is not a replacement for therapy. So if there's something that you need help with, please seek a mental health profession for your individual situation. So, Jen, we talked about a lot in these podcasts. In this episode, we want to go more into what you can do. What are the different types of therapeutic support available for your teen, your kid? So let's start there. Like, what is out there? What are I think in our first episode, we talked about wilderness just a little bit, and we talked about residential treatment programs, but what else is out there? What can parents look for if they're needing the support?
Yeah, I mean, that's a great question. And I think there are a lot of resources out there. And I think that can be part of the challenge, right? Because parents can get overwhelmed in their choices. But I think you just have to start somewhere. And so, I mean, therapy in general is just a great idea. I do think if we're talking about, kids who are neurodivergent, kids who are on the autism spectrum, really they want to find, a therapist who meets that kid where they're at, which, the really common modality of outpatient therapy is talk therapy, which is great, has a place. And I don't know that it always meets these kids where they're at. So kind of going back to starting with like the sensory piece, right? Like therapeutically, how can parents help kids manage that? And so they'd want to be looking for, a therapist who has, if we're talking about therapists, who has experience with some kind of like somatic experiencing, like being able to help a kid understand what's actually going on in their bodies. That's like step one. And then we build, as I talked about before. So I think really just finding a very well-rounded therapist with experience who, again, is going to be affirming in that neurodivergent diagnosis versus like wanting to try to help that child change and become neurotypical. So it's like really that two things there, like really helping that the kid understand that there's nothing wrong with their diagnosis, but more helping them manage their life in a way that, feels better to them.
So are there also, talking about individual therapy, what about social skills groups or like occupational therapy groups? Because they will be going into that, world. Yeah,
absolutely. I mean, occupational therapists are a great option for that sensory piece, for, like I talked about in a previous episode, like helping kids really understand the stimulation that occurs in their body, whether they're being understimulated or overstimulated. We always talk about overstimulation, but we don't talk a lot about understimulation, which is interesting because that's when kids get bored, and that's problematic a lot of times for kids, is because then they make choices out of boredom that aren't always the healthiest. And so it's helping those kids as well learn, like, when I'm understimulated, what do I need to get to a level of stimulation that's actually motivational, and helps me kind of function at a better level. Speech therapists are great. So they will help a kid learn kind of the social thinking piece, like understanding language and interpreting language more, facial expressions, gestures, body language, all of that. So there are social skills groups out there. I'm kind of smiling a little bit because, again, like I don't know that they're always the answer unless we've taken care of those other pieces first. So again, it's really important to think about it in a step process of what do we need to take care of first to help these kids, and then tack on, are they ready for social skills? We often do it the opposite way, and that's why we don't see the improvements. We don't see long-lasting improvements.
So coupled with all of that, what would be the potential benefits and risks of medication? I mean, is there a way to effectively treat with medication ASD and ND, and what are the risks and benefits of that?
So when we're using, and I'm coming at this from, I am not a prescriber, but have had experience working in collaboration with medication management. And really where medication management comes in is to help with the symptoms that may be as a result of not being able to navigate the social world, right? Yeah. So the depression and anxiety, like we talked about in a previous episode. And so that's what you're looking at, is like, we're not trying to medicate the ASD or the neurodivergent brain. We're trying to medicate the symptomology that has come as a result of not being able to function in the world in a way that is, well or healthy. And really the medication, if you have a good prescriber, really the medication is going to be a short-term option. It's going to be take the edge off a little bit so that then you can do the work that needs to go along with making improvement and change in your life. It's not just to like, this is the fix, right? It's just, it's something that should go hand in hand with the other modalities that are, at someone's disposal.
On that kind of line, are there other professionals? We talk about educational consultants a little bit at the ranch. Are there other professionals out there besides therapists? What is an ed consultant, first of all?
Yeah.
And more along that line of people that can help.
Yeah. So you mentioned educational consultants. So I'll just kind of talk a little bit about them and say that, I think that if I were a parent looking for what I didn't know I was looking for, I think that's part of the issue, is parents go into this kind of blindly, like they don't totally know what they're looking for. They just know they're trying to get help for their kid. The consultant is a person that is what they do. They find exactly what you need based on what's going on with your child. And so they'll be able to take a history, talk to the kid, talk to the family, and then sort of assess based on what they've been told, and maybe doing interviews on here are the options for you. This is what I see as being, maybe programs that could be helpful, or something else that might be helpful. It doesn't necessarily have to be a program, but yeah.
So is there a certain point that parents, when they're looking for things like this, are there signs? Are there signs when they should be looking for an ed consultant? When something's happening in their kid's life that they need, that happens, that tells them they need to look for that?
Yeah.
Or even residential treatment. Is there a sign, something that they can look for that says, I think I need to look for a residential treatment for my kid?
Yeah. I think when a student, a teenager quits engaging in their life in a way that is sort of developmentally typical, that would be a big red flag, right? When they are not, they can be experiencing hardships and struggles, but when they've started to develop sort of maladaptive coping that then pulls them out of their sort of developmental engagement, right, for their age, and maybe the behaviors become riskier and riskier. Things like the things I think of kids I've worked with are the common sort of maladaptive symptoms that we see that are the things that end up, having parents decide they can no longer do anything for their kid would be, lots of isolation, lots of school refusal. Obviously drugs and alcohol can be a big one. And I'm saying all of these, that these are typical symptoms within the ASD and neurodivergent population as well. Risky online behavior, trying to find that group, find that connection, and suicidality, self-injury. So really things that, maybe small little doses of that could be seen as this is normal-ish teenage behavior. But when it becomes the level of this is the coping that the kid is using, that's time to look elsewhere for help.
So how do you evaluate that? You might have an educational consultant, but how do you evaluate where or what kind of support you need as a parent, but the kid needs more?
Yeah.
Residential treatment, all of wilderness. How do you evaluate that?
Yeah. So, in all my years of doing this, we've often had every kid that we've ever worked with this isn't their first stop, right?
Yeah.
Like they have tried everything before this, that they have done their outpatient therapy, maybe hospitalization, maybe partial hospitalization. And so typically it's like the evidence is there that these types of, treatment interventions are not working. And so we've often been referred to by an outpatient therapist because they recognize that, one time a week, in the office is helpful for that moment, but then the kid still goes back to the environment that ultimately that's, especially when we're talking about ASD kids and neurodivergent kids, it's not necessarily them and their behavior. It's actually the environment that they're living in that is this trigger that creates all of those things. And so when you go back to that, we're not seeing any sustainable or long-lasting change happen.
So what I'm hearing is there is kind of a flow to where residential treatment fits into that flow. Once they get here, what are the benefits of that? What are the benefits of a little longer term treatment that keeps them engaged and working towards? Yeah. I
mean, I think you said it a little bit, which is longer term, right? So one of the benefits we have is time. We have time to take the pace that we need to take. With that comes parents, needing to understand that and needing to be engaged in that. And so at the beginning, for me at least, the process is always the same, as getting real buy-in from the kids and real buy-in from the parents that this is not a quick fix, and we don't want it to be a quick fix. We want to, allow for change to occur, and we actually want to allow for problems to occur too, right? This is a place, when you're in a controlled, sort of safe environment, it's a perfect opportunity to see struggles happen in the same way that they were happening at home, because then we can manage them in an effective way versus them not being managed effectively at home.
Whereas if you were in a shorter term place, you might not even see those things come up within that time frame, right?
Yeah, you may not. And you may see, like in short term, you see a lot of like symptom management. So we're managing symptoms and we're getting by and we are we're maintaining for just a period of time. And then, we see that, the same maladaptive stuff comes back. We want the time to be able to see all of that. And that's what we do see.
And I'm assuming you kind of lean on the professionals. I mean, parents, as a parent, you would have the educational consultant or whoever you're working with to find out if a residential treatment would be good for your kids, right? Because average stay, I would say, is 8 to 12 months. Would you say?
Yeah.
Is that kind of where we're at? So how do you know? I mean, that's hard. That's hard for a parent.
It's very hard.
How would you come to that conclusion, and who would help you do that?
Yeah. I mean, I don't think it's easy for any parent, and most parents that we've worked with over time would say that they have this sort of complex emotional experience when they make this decision. The common theme is guilt, anxiety, but relief also. And then there's guilt because I feel relieved, right? So it's kind of this circular thing that happens. But I think ultimately it's the parent, I think the parent has to decide, I can't help my kid anymore, right? I've tried everything.
Which is not easy.
It's not easy at all. And we don't pretend that it's easy. So we provide a lot of support for those parents throughout their process here. One of the things that we do is we do a parent support group every other week. And so we have a lot of, the newer parents will jump on, and again, they're just really happy that they're not alone in their experience anymore. They're happy they're not the only ones feeling guilty about the decision that they made, right? So we do a lot of normalizing of that. But yeah, it's not an easy decision. And at the end of the day, it's like, what does your kid need versus what do you need? And if we're only relying on what we need as a parent, we're probably not going to make the best decision for our kids.
So what questions do they ask? What, if you're looking at, you've made the decision, but what questions do you ask as a parent to say, this is the place I want my kid to go? This is the thing that I think will help them the most.
what questions do the parents ask?
Yeah.
I mean, they spend a lot of time with us. So the process, I will just say, like, there's a lot of questions. I think every question gets asked because, our admissions team works for hours upon hours upon hours with families to really help them understand what we do. We won't admit somebody without them having come to a tour with us, and so they can see it, they can touch it, feel, all the things, so they can get a sense of where their child is going to be for the next little while, whichever that's 8 to 12ish months. And they are connected with them, right? Like they are connected every week with them through video therapy, other phone calls. And so I think it's like, it's really, they do ask all the questions. I mean, there's been some wild questions. I can't think of one off the bat, but I'm like, wow, no one's ever asked that question before. But, and I get it. They want to know, they want to make sure, they're doing the hardest thing probably they've ever done, which is hand their child over to people that they really don't know.
Right.
And so we don't take that for granted, for sure. I mean, I think about that every day, that these people are trusting me. These people are trusting our team with their child to take care of them, to help them.
So let's talk about DRS a little bit more. Why would a parent choose DRS over another program? Like, what sets this apart?
Yeah. I think the first thing that always comes to mind, and part of it's because I'm looking at a picture of a calf on the wall right there, but is our experiential piece. Yeah. We talk about that a lot. It's what we're known for. So the areas of experiential therapy that we utilize to help access what kids need. So performing arts, recreational therapy, and the equine and calf program. And a lot of people can say that they do that, and they probably do, but I think we do it at a level that is kind of back to thinking about neurodivergence and ASD, is that we're looking for ways to manage and help that sensory piece, right? Yeah. And you do that, you get there by doing sometimes. Like we can all talk about what's going on in our body. We can all talk about our feelings, but until you're actually doing something to have those things pop up in the moment, that's real life, right? Like that's real life awareness, and then real life ability to make change in the moment, or just at least develop a deeper understanding. And so I think that our experiential piece is superior, honestly, to at least from a therapeutic standpoint, than a lot of programs that I know and have been involved with. And it gets us away from kind of that traditional talk therapy. So we're accessing what these kids need by doing a lot of the time. So I think another thing that is really unique, maybe different about us, is that we do have people at every level that have been here for a long time. And I think that says something about our program. I mean, from administration to the clinical team to the residential staff to, we have residential staff that have been here since the day the doors opened, who have stayed because they believe in what we do. They maybe have moved around in positions as residential staff, right, to kind of grow themselves. But I think ultimately we have this team of people that really believe in what our goal is, right, is to help kids and re-engage in their lives, help restore families, ultimately live their best life. And so I think that if I were a parent, that would mean a lot to me. If I were a parent looking for, residential treatment setting for my child, I think that's huge. Someone that can speak to even the changes that have occurred over time with a program. I think just clinically, we are very sophisticated. One of the things that I think we do extremely well is really practicing what we preach around our treatment team approach. Lots of residential treatment centers say we do treatment team approach, but the reality is we have so many eyes from different areas on this kid that can lend to sort of the kind of conceptualization of what's going on with them, that really gives us the opportunity to treat the whole child, right? Because 5 different departments are engaging with this kid and are able to like speak to, this is what I'm seeing, this is what I'm seeing, so that we can help them the best, rather than just one therapist once a week or twice a week. We have everybody's engaging with the kid.
So can you go into how that really is a benefit for the ASD and neurodiverse community? How does that, and what else does DRS do in that realm that sets us apart?
Yeah. So I think one of the things is that, being able to have those different relationships seems really important. One, because it creates kind of diversity in the learning. So you talked about this earlier. We talked about this in one of the previous podcasts, which is like, we want these kids to be able to like learn sort of different ways of being with different types of people. So they can build their repertoire over time, right? So they leave here, they're like, oh yeah, like this, this person's like Nate, this person. So they have more information that they leave here with. I think it's like learning a skill becomes stronger when you practice it in diverse settings. So you have like 5 different places that you can practice this new skill. I think when you only practice it in one place, like in therapy once a week, it's great in therapy, but then how do you move it outside of that? So that's what we're doing, is these kids have an opportunity all day long, right, from the time they get up to the time they go to bed, because they're engaging in so many different areas with rec, with performing arts, with the cabs, with equine, that they can practice those things and then get real life in time, real time feedback from the people that they're engaging with.
We talked in the first episode about the comorbidities with ASD and ND students, like anxiety, depression, ADHD. How does that affect their treatment options? What does that look like in a residential treatment setting?
Yeah. So, I mean, it's really, we're going to treat the symptomology first, essentially, right? Like figure out, what does this kid need to reduce their anxiety? What do they need to like reduce their depression? And ultimately we figure out what that is over time. So sometimes it's just re-engaging that allows that symptom management to happen, like re-engaging in their life. But we figure it out through, we might use a different type of therapy. It might just be like getting outside. So ultimately we're treating the symptomology. We want to decrease it. That's always our first thing, is we want to like decrease anxiety. If it's depression, we want to decrease depression. And then once we're able to like get them to the point where that's manageable, I think then the deeper work starts, right? Like kind of comes back to that system of, where do we start? We start with the sensory experience first. That's the depression and anxiety that goes into the emotional part. So, and we're able to do that through everything we do here, ultimately.
So there's a lot that goes on at the ranch, all geared towards helping these kids. What are some of the other programs that we have on the ranch that work into that therapy and their treatment? Yeah.
So one of the things that's unique about us too, that I think is it takes people by surprise a little bit, but then they understand why we do it the way we do it, which is our academic setting. So we do academics in the afternoon, and 3:00 academics start. So our students have been able to like do all the other structure of the day, including their experiential pieces, their therapy, maybe family therapy, and then they go to school at 3:00. Interestingly, that's about oftentimes when the teenage brain really gets going, right? And so it might be hard to adapt a little bit for some kids because they're not used to it, but actually once they get into that system, they function really well during that time period of school. School is a hybrid approach to learning. Essentially, we have teachers in the classroom. I think we do a really good job of, individualized, like when a kid first gets here, if they come to us with school refusal, we're just trying to get them in the classroom, right? Just trying to get them in there. A lot of kids have had potentially negative experiences with school for whatever reason. And so we want to like create a new association with school Sometimes we just want to get them there. But then ultimately they can work at their own pace, whether they're at grade level or not grade level. And we have small classroom sizes. And so it's an opportunity for our academic staff, residential staff, like everyone to kind of chip in and help meet this kid where they are academically. I think a lot of times kids, because they get the more one-on-one focused attention in school, they learn a lot about their learning style and figure out like why they weren't doing well in school before. It doesn't necessarily mean it's because a kid doesn't have the intellectual ability or cognitive ability to do school, but there was something about school in general, whether it was the environment or just the way in which they were trying to learn, that wasn't working for them. So,
and there are people on the campus themselves. I mean, the mentors. I'd like to talk about the mentors just a little bit.
Yeah.
The people that are with the kids 24 hours a day and really building the relationship and being that mentor.
Yeah.
So let's talk about the residential side of things, how that functions, and what the employment on that side of things looks like.
Yeah. So I want to speak to it in terms of the neurodivergent population a little bit first, and then maybe in general. But one of the things we started doing just about a year ago was I meet with the staff every week. So I do a training with them every single week. It's mandatory. They got to figure out some way to get there. And we talk about ultimately, there's all kinds of ways we talk about stuff. We talk about the kids individually. I may do a training on something that is related to being neurodivergent, some of the things that we've talked about in the previous podcasts, but really we want our staff to be educated on this population, right? And to understand, again, back to like, these are kids that have lived in a neurotypical world, that have been tried to like kind of be forced into that world. And we don't want to do that to them here. And if I'm a neurotypical adult, that may be my kind of, propensity would be to do that, to be like, why don't you just, do this, do it that way, kind of thing. And so we're really trying to educate them. It's been super successful in terms of like their own knowledge. Every week, last week, just thinking about an experience I had, we were talking about the nervous system, and I was educating them on how the kids show up, like in terms of like dysregulation. And we were going through sort of each of the kids and talking about them. And the mentors were able to talk about like their own dysregulation and how they kind of gravitate towards like hyperarousal or hypoarousal, and really walked away with it going like, oh, wow, like this is where I can do more work for myself, right? It's not only going to help me in my life, but it's also going to help me co-regulate with these kids better. And so that's the goal, is that these, we want them to really understand who they're working with, who this population is, who these kids are, to, ultimately empower them to help the kids better. As far as like the environment goes, we worked for a while with a consultant to help us like look at the actual environment of the cabin that is our ASD and neurodivergent cabin, in terms of just like lived experience. We talked, she talked to the kids, we talked to the kids, talked about kind of just the actual physical environment of the cabin, to make sure that we were, adjusting things that would make their lived experience better. This
has been very informative for me, because I haven't lived in this world for 13, 14, 30 years, anything like that. So we've been through a lot of subjects over the last few episodes. Appreciate your time again. Is there anything else that you would like to give to our listeners? Maybe something that would give them a little more hope, or somebody that is working with a neurodiverse kid, or somebody that's on the spectrum?
Yeah. So I borrowed this, or this is something that helped me as a parent, as a therapist, as a human being. Something someone told me I don't know, 12, 13 years ago, and I use it to this day. And I think sometimes people always say, Jen always says, and it really wasn't me that said it originally, but it still is a thing that I think really I resonate toward, which is we're not trying, I think, to remove struggles for people. We're not trying to like make everything okay and help these kids. I said earlier in a episode, parents often will be like, I just want my kid to be happy. And really what we're trying to do is help kids and families struggle better. So learning to manage their struggles, right? Because it's life. We're going to have them. But to this point, these families and these kids have not been able to navigate their struggles effectively. And so we're helping them struggle better. And that is ultimately my number one goal always in the work that I do, is that if we get to a point where we have a struggle and we recover quicker from that struggle, we're doing great. So struggling better is the thing that I always hope for.
Right. And I think especially I've learned there's so much resources. There's so many resources and tools out there. If you don't know what they are right away, search them out and they'll be there for you. There are resources in every community for you to help with that.
Yeah.
So
and you don't have to be alone, right? Like there's I think that's the thing parents find when they come here, and kids too, like is that, oh wow, there's all of these people out there I didn't know were having the same or similar struggle that I'm having, and that actually feels really good to feel validated in the struggle that I've been having.
And to being able to say, yes, I can lean on that too. I can lean on that experience. So great. Well, thank you again.
Thank you.
My name is Nate Marble. I'm here with Jen Hedrick, the Clinical Director and Associate Executive Director of Discovery Ranch South here in Cedar City. It's been a pleasure.
Yeah.
It's been a really pleasure to talk with you today. If you have any questions, please feel free to reach out to us. Our website is www.discoveryranchsouth.com. Thanks for listening.